Health Watch is presented by UMass Memorial Health Care. Here, caring for you.
What is a complex aortic aneurysm?
Generally, we think of aneurysms as being relatively straightforward simple aneurysms or complex aortic aneurysm. And the real distinguishing feature is that a complex aortic aneurysm involves critical branch arteries that come off of the aorta. So example of those would be the kidney arteries, the intestine arteries, the arteries that go to the arms or to the brain.
What are the surgical options?
This would be a straightforward aneurysm repair, where you could imagine just putting this tube directly below the kidney arteries, and you don't have to worry about branches coming off of the aorta. Whereas this is an example of a fenestrated graft, and the real main difference is that this one has these holes put in order to be able to line up and accommodate these branch arteries. Because again, if you now bring this repair above the kidney arteries or above the intestine arteries, you need to find some way to maintain blood flow out to those critical branch arteries. And that's really what a fenestrated endograft can do.
How does recovery differ between the two types of surgeries?
An open thoracoabdominal aortic aneurysm repair, which is really what we're talking about when we're thinking of these complex repairs, is a really big deal for a patient. Usually they're in the ICU for several days after the surgery, whereas with an endovascular or minimally invasive repair, we can often get patients through the repair going to the normal ward and being in the hospital for only 1 to 5 days.
After the minimally invasive procedure, does the patient resume a normal lifestyle?
My hope is that they're fully functioning, living independently, enjoying their activities within 2 to 4 weeks after their repair. And that's usually the case.